So Dr. Atul PUTHALATH is going to talk about 3D printed LAG, lens attachment guard, a novel protection system for lenses used in ophthalmology. So the discussant
Dr. Anand Saxena.
is Dr. Anand Saxena. Yeah.
He has two talks, one after the other. Dr. Atul.
Can you also announce? What has happened is, who are the two people who are not there? Those two.
Good morning, everyone. I just want you all to do an exercise with me. Kindly take all of your phone out, and if you turn it around, what do you see? Do you see a protective case or cover? Most of your phones are protected because they are expensive. You want to keep them safe, right? So what about your lenses, what you use in Opthal day in and day out? Do you want to protect them? So I will talk to you about LAG, Lens Attachment Guard. It is a 3D printed LAG series, a novel protection system for ophthalmological lenses. So how did this idea come to me? So in our retina laser clinic, the PRP lenses, which cost an immense amount, it breaks because if it falls and gets in contact with the ground. So it can either slip from the surgeon's hand, or some of the patients are really uncooperative. You have to laser. If you don't have a multi-spot, your single spot will take time, and patients will get restless, and the lens can fall. It has happened to multiple fellows in our center. So I was thinking, how can I prevent this from happening? So I thought to myself, how about we give some soft flooring on the floor so that there is some cushioning. The instruments department helped us in covering the broken areas with M-seal to try and use on cornea, but that is not cornea friendly. It's not, because M-seal is not biologically acceptable. So we wanted a better solution. So we decided to design and 3D print a new guard, and then we wanted it to be mounted onto the slit lamp, and then we went on to the prototype and then testing it. So if I'm printing on doing something, I wanted it to hold the lens firmly. It should be easy to attach and detach from the lens, should not interfere with the corneal contact region, should be attached to the slit lamp or maybe to the wrist of the person who is giving the laser. And obviously it shouldn't be a hindrance to the working or viewing area, and definitely it should be low cost. With these points in mind, we CAD designed, and then we printed our first prototype using a 3D printer during Hackathon 2.0, which happened last year, using TPU, thermoplastic polyurethane. And this is the final, the first prototype that you see here. It has a winding clip, a thread lock, and a lens holder. This is the lens hanging from the center of the forehead support of a Pascal slit lamp. So let's look at how it is set up. So you take your lens guard, and then you fix your PRP. I am showing a Mainster 165 lens, the most commonly used PRP lens in most of the laser clinics. So once it is fixed inside, then you can, using a cable tie, you can just mount it there and then apply the laser. So since you might have noticed in the first prototype, the footprint was large. It was a slightly bulkier. So now we have gone to make PRP LAG 2.0, which you can see in this image. It's very, very thinner footprint. And we have tried making it in silicone material also, which is similar to our silicone phone cases. And also we thought, why don't we make it for all kind of lenses? We want to, some people will have a high volume setup in a large center. We want the lenses to last for a long time, and we wanted adequate protection. You don't want it to fall down. So we designed it for 90D and 20D as well. And now, why don't we, so we thought, why don't we give it more color, make it more acceptable to all kind of audience? Maybe you can engrave your name onto the case. So we gave it many aesthetic variations as well. Now we are also making it for gonioscopes as well, so that the gonioscope can hang from the slit lamp and doesn't fall down on the floor, because this will definitely be a boon. I know, not for an expert person who's been in the OPD maybe for a number of years, for the PGs who with their hard-earned stipend might be buying a lens or two and they don't want it breaking, and people might refuse it. If a senior comes to you, ask your 20D, you obviously have to give it, and you expect it to be protected and not damaged by the thing. So thank you.
We might have the woman wanting one for each dress also. You never know.
It's a nice presentation and good thought.
Yes.
But tell me one thing: you have made for the 20 diopter lenses also,
Yes.
and so many times we have to use in the operation theater. So how to sterilize it?
No, sir. This is only for the OPD, sir.
That is not for the operation
Not,
theater.
not,
This
not
is
for
the
the
one
OPD.
point that we cannot sterilize it.
Yes, sir.
Okay. And second thing, how much is the grip in these lenses? Because I've seen the surface is very smooth.
Yes, sir. We are giving it a grippy, like your cricket bat grip. So we
Okay.
are giving it
But so
friction.
far it's as you have shown, it is a very.
Yes, sir. This is the prototype. I'm working with Orolab now. We have gone to the third prototype now. So soon we'll be printing it in silicon with a proper grip, and we'll also be doing a drop test also. Like when new phones come out, they will do a drop test to see how the case is protecting. So we are acquiring more lenses to do a drop test to see how it withstands the shock.
Okay, thank you.
Thank you, sir.